Right, so good morning, everybody. It somehow feels very strange to have jazz outside and laughter and all of those sorts of things on the site of an acute hospital trust, but it's great and it's really exciting. So I'm Hattie Owen-Davis and I chair Bucks Healthcare. And on the front row here, looking at the back of their heads, Lou Patton, who's the Chief Exec of the CCG, Neil MacDonald, Chief Exec of Bucks Healthcare, James Drury, Finance Director, Bucks Healthcare, Raj Bajwa, Chair of the CCG, and Gary Henage, Finance Director of the CCG, all of whom are going to speak, but briefly, because we don't intend to make this a boring, lengthy AGM. That's not our intention. Today is the first time we have ever tried to do a joint AGM between the CCG and the Trust. And it is in recognition of the way that we are now working together in partnership and building real links and developing better healthcare services for the local community. We hope that by having the open day outside, we're attracting some people in to find out more about what we do in ways that we've never done before. We're very excited by having our first ever open day, and we hope that we'll go on to do more of them in different ways and in different places across the organisations, both of them and the way they run services. Can't begin today without recognising, as it says up there in the top corner, this is the 70th year of the NHS. And it is remarkable just what the NHS has given to the country and indeed the world in terms of improved healthcare, improved life expectation, all of those sorts of things, ranging both from very acute medicine right through into the community and into the way we provide community services and services at people's homes. We recognise very strongly as the two organisations in Bucks that we couldn't have done any of that without the staff and volunteers who make this organisation what it is. And on behalf of both boards, for those of you who are sitting in the audience, thank you very, very, very much for everything you do in whatever capacity you do it. It is you who makes the NHS great, not anyone else. Over the next half hour, you're going to hear a little bit about what we've been up to in the last year. And then at the end, there's an opportunity for any of you to ask questions who wants to.
So it's always very awe-inspiring to see the achievements of staff, both clinical staff and our support staff who make their jobs happen. And I think we should just pause to recognise those achievements have been delivered in a time where actually we would recognise this is one of the most challenging times to deliver healthcare or any kind of care really. A combination of a number of things for us that we work through as a system. So demand for our services, particularly emergency services, up 5% this year, or last year rather, both in the hospital and the community. Workforce challenges, so we are working in a care system where 1 in 9 posts are vacant, so we know we don't have the skills and some of the professional resource we need to deliver some of those care. And we would reflect, I guess, some of those achievements have taken place in probably, people would recognise one of the most challenging winters that we've been through in recent times, combination of flu, snow and demand on our pressures. And we should all celebrate, I think, our staff who've managed to achieve those things despite that and recognise that we operate in such times. So if we can just touch on some of the performance aspects before I hand over to the finance guys that are relevant for us. So in terms of access to our services and how rapidly we're able to treat people. So we wanted to sort of three key things that we are judged by as an organisation, as a system. So in our A&E, we have a national target to hit 95% of patients seen, treated, discharged or admitted within 4 hours. Our performance up there at 87%. National average is about that number. Really, that reflects the winter we've had. A couple of examples on the video you've seen around the GP streaming service, which was a real system coming together of putting resources in the right place and is actually going from strength to strength. And also, I'm going to try and not call it the rat pod, because it sounds like we've got a sort of vermin problem at the front of the hospital. But the rapid assessment and treatment extension we built into A&E has seen some dramatic reductions in our ambulance handover delays. So we now perform the best in the region for that. And we've got more building work and more space and more refurbishment work to do over the next 6 months to prepare for how we go forward. Cancer patients, that's 62 days from referrals. Our target is to see 85, 83.7, national average is 82. So some strong performance there, but more work to do, particularly on those urological pathways for our cancer patients. And then referrals, elective 18-week waiting times, 90.5%, national average about 89%. Some real progress in some of our surgical specialties, but still some work to do in areas like ophthalmology in particular and orthopedics. And then just to reflect on some of our quality outcomes. So the mortality ratio for this organisation remains strong, so 10% below the national average, or 10% better than the national average. Something that we're really proud of in terms of the quality of clinical care we give here. And you can see some of the improvements we've made in terms of recognising the deteriorating patient, getting to them quickly and reducing in-hospital cardiac arrests. Steady progress on some of our other quality indicators around harm, looking at how we reduce falls in with people in our care and looking at how we prevent severe harm when people fall over. A continuing struggle we have around infection control. We're not where we need to be yet, particularly around our C. diff, and some more work to do with that. And you can see in some of our pressure ulcers in the hospital, and we've had, after 2 years of significant reductions, we've just had a little bit of an uptick in there, which reflects generally how busy we've been and some of the occupancy levels we've seen over the last 12 months. And again, how we are starting to develop and get much better in how we speak to our patients and how we respond to our patients. So driving much greater feedback. And actually, through all those pressures, we're proud that we're able to continue to remain a pretty high rating in terms of patient feedback for us and getting much better about how we respond to complaints in a timely fashion. So I think you'll see a theme through what we discussed today, all through the presentations around, I guess, recognising our staff, all staff across the care system, both those frontline clinical staff, but the really important job that our support staff and our corporate functions play in making them do their jobs. There are some significant changes coming to how we redesign the health and social care systems in this county, which is the vanguard of what will be done nationally. So we are tackling these challenges with some innovative and some really vanguard leading solutions, which Lou will talk to you about sooner. So, having said that, I'll hand over to the finance guys.
So in terms of the financial position for Buckinghamshire Healthcare Trust, we reported a deficit for the year of 2.9 million. On an underlying basis, our deficit was 7.9 million, so a 1 million improvement on last year. We have two statutory duties which we report in our accounts. The first is the external financing limited, which is effectively the amount of cash we have in our account at the end of the financial year, and we met that. And then secondly, a capital resource limit, which is the amount of capital we spend, and we complied with that statutory duty. In terms of our better payment practice code, which is how quickly we pay our suppliers, we managed to pay 81.5% of our invoices by value within 30 days, but by number of invoices, that's a much lower number at 52.8. From NHSI sets a target for us in terms of our agency spend, which was 12 million for 17-18. Our agency spend was 2 million under that limit, so it continued a trend which has seen us reduce our agency spend from 18 million down to 12 million and to 10 million in 17-18. In terms of the annual report and accounts, we had an unqualified audit opinion on those and an unqualified audit opinion in terms of value for money. If I then move on to the Buckinghamshire Healthcare Charitable Fund, our income during the course of the year was 0.7 million. We've spent 1.3 million in line with the objectives of the charity, so medical equipment and research projects, welfare and amenities, training and education courses. So this is all contributions from donations, legacies and investment income, which are then reinvested back into the activities of the trust. I would also like to take the opportunity to thank all of the donors who have contributed to the charitable fund and also to the other charities who have made donations to the trust during the course of the last financial year.
So, good afternoon. So I'm here to just provide an overview of the annual report and accounts for two CCGs, that being Aylesbury Vale Clinical Commissioning Group and Chiltern Clinical Commissioning Group. But before I go into that, I thought it'd be helpful if I just set the scene and told you what the CCG does and maybe a bit of background. So The CCG is responsible for commissioning non-specialised hospital services. So that effectively means urgent care and planned care. But we do a lot more than that. So if I just kind of spend a second just telling you what those services are. So, and I think some of it was clearly shown in the video earlier. So it's mental health services and learning disability services, as well as NHS 111, ambulance services, general practice, and not forgetting our community services provision as well. And just to put some context on what that means for a CCG, the value and the income for those services is around £696 million. In terms of the background, well, we were two CCGs at the end of last year, and those two CCGs merged. And a new CCG was formed on the 1st of April 2018, that being Buckinghamshire CCG, which is on the slides. And this, therefore, will be the last time we will report the two CCGs separately. So let's get to the numbers. As the slide shows, expenditure did exceed income for the financial year ending 31st of March 2018, and the combined expenditure, so the combined overspend was £3.3 million. And that was as a result of us spending more on the healthcare needs of the population of Buckinghamshire. That did result in a couple of things. The first being a letter to the Secretary of State from our auditors, Ernst & Young, and the second being we had a qualified opinion for value for money. But I would like to point out that all the rest of the accounts was unqualified.
Thank you. Hello, my name is Lou Patton. I'm a registered nurse, and I'm also the Chief Officer, or the Chief Accountable Officer, I think they've called me here, of the two clinical commissioning groups that are now NHS Buckinghamshire CCG. And I'm here at this landmark joint AGM just to talk a little bit about our work as an integrated care system. And it's just over a year ago that we were given this fantastic opportunity to be one of currently only 10 fast-track areas that have been nationally chosen to help really push at pace this opportunity to integrate our local health and social care services. So our main task is to really fast-track the active encouragement of all of our workforce and our services across all our health and social care providers to work together to improve the services for our population, regardless of which organisation they work for, because sometimes that can get a bit in the way. And a key part of this is also looking at how we plan the future services, because the service planning also needs to be integrated with our colleagues across health and social care. And it's got to start with that really clear understanding of what our local population's health and social care needs are now, what their needs are in the future, how our population is going to grow, whether it's the elderly that's growing or the children, under 16 population that are growing, and what are their specific health and care needs that we need to cater for in the next 10 to 20 years, because that's also really important. Because that helps us plan not only for our growing elderly population, but also for the growing need that we have on services such as child and adolescent mental health services. And it means that we can work with our local district and county councils to really plan, though, not only the right services, but the right buildings, the right transport and infrastructure, the right cycle paths, and the right green spaces to help all of our well-being. We're embracing the opportunities of the digital world to get our information flowing across our organisations, so people and patients have to report things only once, and to develop those innovations such as video consultations. And we do continue to build those strong relationships with all of our NHS providers and our local authority. We need to further embrace our voluntary sector, and we must always remember our carers who provide such a significant role in supporting our NHS. Thank you.
Okay. So, questions from the audience?
2 to 3 years ago, the Children's CCG was on a daily basis monitoring the discharge of almost clinically ready patients who would have care needs on discharge. The result of this was to free up beds at Wexham as soon as possible. This had a positive consequence all the way back to A&E and the ambulance service. Further to this, they had financial benefits to the NHS. With the introduction of the ICS, there should be an even smoother process. Will the Buck CCG appoint someone to oversee this task on an ongoing basis for the benefit of the NHS?
Clearly, discharges from Wexham Park have been an issue in the past, which is why that post was put into place and did work very effectively for the period of time. When I say post was put into place, it was actually our Chief Operating Officer who took this responsibility on for himself and oversaw that. And there were significant improvements. I think it would be fair to say that that grip has loosened very slightly, and that there would be some benefit in looking at that. And it is something we could certainly look at doing. I wouldn't like to speak for BHT, but I'd like to think that that sort of process is already in place. Natalie, would it?
So if you want to hand the microphone to your right, then.
So we do have that process in place within BHT. And just to talk a bit more about the south-facing work we do around discharges. So across the ICS, we do have a south-facing team that are looking at discharges, and we work very closely with Wexham Park on that. And we meet monthly to overcome any blockers and enablers that we need to put in place to ensure that that's smooth on a day-to-day basis. Yeah, we do actually talk about it daily, but it's really to get together monthly, and that's all the partners that are south-facing. So we meet with SCAS, it's BHT, it's the community services, it's the commissioning group, it's the hospital. So we all come together just to see if there are any other things that we need to unblock.
So if I can, so the challenge is really valid. Much of a concern when we speak to colleagues in Frimley and Wexham Park is obviously people in the system. So lots of hard work being focused around solving that particular thing. And there's a clear incentive for us to focus resources in that way as a system, I think, because we know it's a problem for us to fix. Yes.
Just to say thank you for putting on this event, Neil. And just asking about recruitment. In the present climate, how are you going to manage recruitment, particularly from the EU?
Yeah. So, Bridget, specialist subject.
Hi, I'm Bridget. I'm Director of HR. So we are actively recruiting still in the EU. We're really lucky. We've got a great cohort of EU colleagues here at the Trust, and we get most of our recruitment now through Refer a Friend. What I am feeding back to NHS employers is that we are looking for clarity. So every time that we get something back from the Home Office or down from NHS employees, we pass that to our EU colleagues really, really quickly. We've got great support, so it's all about communication. So we will continue doing that, working really, really closely with our colleagues and working through it as it develops. Fingers crossed it's working so far.
And I wonder if, Caroline, you want to touch on Erasmus?
So we have to look at new ways of how we work. So I'm Carolyn, I'm the chief nurse. Got a prompt from my boss there. So a subject really close to my heart. We have to be brave and do things differently. And one thing that's particularly been successful, I don't think the team are in the room. If they are, please put your hands up. We've been working very closely with Portugal for three reasons. One, how do we support and look at nursing as a community so that we look at global nursing, not just within the UK. And some of their very best students have come over to this organisation to work with us, and some have chosen to stay with us. We've also then built relationships with both of the big schools of nursing within Portugal, and we now are directly recruiting because they trust us to look after their students. And then thirdly, myself and Professor Sines, one of the non-exec directors, have been involved in looking at shared research and the coming at the end of this year. The future is us looking at nursing and care without barriers across Europe, and this has been a really great step forward for us.
Hello, I'm a past counsellor. At the same time, I deal with a lot of charity organisations, and one of these is also youth. And a lot of complaints I get, especially one was that here from the Stoke Mandeville Hospital. It was the orthopedic side of it, and everything has gone very wrong with the left knee replacement, and suffered for 2 years. And she is a pensioner. She has excruciating pain with the right knee now, which has seized up, so she should hardly walk. With the right knee, she doesn't know what to do now, she had pre-op assessment. After 6 months, that dies down, that assessment. So another pre-op operation was done, and it is now 8 months, and no date has been given for operation. And every time she phones and left message, no answer. So what can be done now? We didn't mention that to CQC, but we are waiting still now with patience that somebody answer her call when she leaves messages. Nobody picks up the phone and answer. So this thing needs to be looked at. Thank you very much.
So thank you for bringing that this morning, and we apologise on behalf of the organisation if we've not quite got that, clearly not got that right. I can't solve that now without knowing the details, but if you hang on, Karen and Tina will grab you afterwards and we'll get some details and we'll get it sorted out on Monday. But I apologise for...
Thank you very much. At the same time, she had been suffering with infection. Though I'm in infection control team in another hospital, and that infection went so bad that she was on the verge of death. And so it all because of the delay done from the department and from the reception. Okay. So something got to be looked at. Okay. We
will pick up that individual.
And I'm also a member of the BHT from the very first day of the...
Thank you very much. Not really a question so much as a comment and a commendation. I'm Jenny Baker from Health Watch Bucks. Just really wanted to commend this gathering today and the bringing everybody together, which I think is absolutely fantastic in terms of the ICS. But also to say that I've been involved in Health Watch since its inception 5 years ago, when Andrew Lansley wanted to make sure that patients were at the heart of everything the NHS did. And I reflect there's been a real step change locally over that period, accelerated by ACS, ICS and all the other national and local initiatives. But there seems to be a real sort of buzz from my point of view locally. I thank you very much on behalf of Health Watch Bucks for allowing us as a very tiny organisation compared to massive funding that we've heard about, but for making our life easier in challenging you, but also working closely with you to make the patient voice heard and things better for patients. And there have been some really good examples over the last year where we've done specific projects with you and we've fed back, and you've actually taken those very much to heart and take our comments very seriously and feed back to us on what we're able to help you make a difference on. So I just really wanted to acknowledge what I think is a very harmonious relationship and for making it easy for us. Thank you.
Good, thank you. And thank you for coming today, Jenny, and sharing that in front of you, Liz.
I just wonder if it is acceptable to be pointed to the internet to access information on a diagnosis.
Say more. Have you got a specific example?
And perhaps to be advised that the trust doesn't hold such information.
Tina?
It seems to me there's a story behind this, and I would suggest that we meet afterwards. And could I hear your story? And then let's do something about it. Would that help?
Perhaps that's a reasonable way forward, but I just feel for the wider population that if there's a diagnosis given, you shouldn't be advised that the trust doesn't hold such information.
Shall I? What I think I'm hearing is that we don't have paper leaflets or information. So you're being guided by our staff to the internet. Is that what?
That's it.
And, I agree there's much more that we need to do to say, how do we use many different ways to communicate with you? The most important is obviously face-to-face and following that up. So as Tina and my colleague said, we certainly could be happy to meet up with you straight after this meeting to just have an understanding of what would have been more helpful for you or the people that you speak for.
But I don't want it to be just a personal issue for me, and I also want to make the point that information on the internet may not necessarily be reliable. And I think more importantly, it's not appropriate to say, find it on the internet.
So I apologise. We've done a lot around using films within learning disabilities. We've used different materials to translate, care. We're trying all the time to provide different ways of how we can give people information, because we have to make sure that people are informed about their condition so they can work with us around, managing that care. So I apologise if that was your experience.
Well, I just want to say, if you've been delivering Care A for a number of years, it doesn't leave me with much confidence when you're sending me somewhere else to learn about a particular situation.
Understand.
There must be some expertise you yourself must have developed over the years that you can perhaps share with the patient.
Absolutely.
But I think it's a matter that you need to look at for the wider community, because I'm sure it's not just only me. Thank you.
Thank you. My name is Michael McCoy. I don't have a question. I just want to say thank you very much. I don't get sick much, but I got very ill a few weeks ago and I got brought out here. And I was taken care of at the AMU, the acute place. And I was treated with such respect, care, and love. But it made me look when I went home at the executive corporate side of the NHS. And I just wanted to say thank you very much for the enormous job you people do, because it is such an enormous responsibility. You do it very well, and your team work very well with you. Thank you very much.
So, Michael, I'm really glad you're better, and thank you for sharing, and I'm sure you've passed it on to the team as well. Yeah, great to see you, so thank you very much. Great, I will hand over to Raj to finish.
Speaker, the title on the slide is Thank You, and it's a two-part thank you, but before that I'll say this is the first time I've ever spoken to a public audience with jogging clothes on. The first thank you is to those of you that have given up your Saturday morning to share the first combined AGM with us. And the feedback, positive and not so positive, is the kind of thing that we need to develop. The second thank you, and one I'd like to spend a few minutes on, is for all of those individuals that help deliver what we call NHS care in Buckinghamshire. And I just want to spend a few minutes reflecting on that. And we've seen a film with some of those individuals. You'll see pictures of them up there, and some of them are in the audience. And I just wanted to start off by picking up on something that the Chief Executive of the NHS said in his address at Westminster Abbey, which celebrated the 70th anniversary, or the birthday of the NHS. He reflected on the fact that the NHS is often there at some of the most profound moments of people's lives. And that got me thinking, that's quite right. It's there when a baby is born. It's there when people get acutely ill. It's there during an accident. It's there during a course of treatment, such as chemotherapy. It's there during surgery. And actually, it's also there in the moments and weeks leading up to death. Now, in order for us to entrust those episodes to a group of people, that group of people need to be really, really special. And a lot of them are in the group, and they might be a nurse, they might be a paramedic, they might be a therapist, they could be a scientist, they could be an administrator, a manager organising care. They could be a clinician, they could be a social worker, they could be a carer, and that carer could be a member of the family, or they could be from the voluntary sector. And it requires all of those individuals working together to deliver the care that we would want for ourselves and for our loved ones. So it's a big thank you to all of those individuals. Our NHS is built on the care and support that you provide. That's really all I wanted to say. And once again, thank you for coming today, and I hope you enjoy the rest of the open day. Thank you.
There's a film celebrating the 70th birthday, which will be running as you leave and go, but please enjoy the rest of the day, have a tour of the hospital, have a look around, and thank you so much for coming, and for those of you giving up your time today. So, thank you. Oh, and thank you to Leslie and the team for their magnificent organisation of today.